Tobacco smoking is a leading cause of hospitalization, overall healthcare utilization, and mortality. In Canada, smokers average twice as many hospital days as never smokers. In every jurisdiction, healthcare systems are experiencing the growing burden of chronic diseases and are under pressure to reduce avoidable hospital readmissions. Hospitalization provides a unique opportunity to initiate smoking cessation interventions in order to help smokers quit. The objective of our study was to determine whether implementation of the Ottawa Model for Smoking Cessation, a hospital-initiated cessation intervention, would reduce mortality and downstream healthcare use. The Ottawa Model for Smoking Cessation was developed at the University of Ottawa Heart Institute and has now been disseminated in over 350 healthcare settings across Canada. It is a practice management system that offers practical training to healthcare staff and implements tools and procedures that ultimately lead to the systematic identification and documentation of smoking status of all patients, the offer of pharmacological and behavioral support to smokers, and attachment to long-term follow-up after hospital discharge. We completed a two-group effectiveness study at 14 hospitals comparing patients who received the Ottawa Model intervention to pre-implementation controls. Before implementing the Ottawa Model, we conducted a screening of consecutive patients at each participating hospital, asking patients about tobacco use. 641 current smokers were screened and enrolled into the control group. This group received usual care, which consisted of, at most, the provision of self-help material. Then the Ottawa Model was implemented, after which a second consecutive screening of patients was completed at each hospital. 726 smokers who had received the Ottawa Model were screened and enrolled into the intervention group. We linked baseline participant data from both groups to healthcare administrative databases at the Institute for Clinical Evaluative Sciences in Ontario to determine the following outcomes at 30 days, 1 year, and 2 years following the index hospitalization: all-cause and smoking attributable readmissions, emergency department visits, physician visits, and all-cause mortality. Our data found that 35% of patients who received the intervention were smoke-free at 6-month follow-up, compared to only 20% of control participants. Patients in the intervention group were 50% less likely to be readmitted to hospital for any cause, and 30% less likely to visit an emergency department at 30 days. In the long term, patients who received the Ottawa Model were 21% less likely to be rehospitalized and 9% less likely to visit an emergency department at 2 years. Most importantly, we observed a 40% reduction in 2-year mortality risk among patients who received the intervention. To conclude, we observed significant early and sustained reductions in mortality, rehospitalization, and emergency department use following implementation of the Ottawa Model hospital-based intervention. Our data support the case for broader implementation of systematic cessation interventions that initiate treatments in hospital and attach patients to follow-up support. Strategies like this will reduce subsequent healthcare use, but most importantly, will distinctly enhance the well-being of our patients who smoke.